Hey, Dr. C here with you. So let's talk about how you can feel your best without a thyroid. People wonder if they can live without a thyroid and if they can live well without a thyroid, if they can thrive without a thyroid. And the short answer is yes. I'll talk a lot about the details, don't worry about that. But for starters, I want you to know that you can feel your best. In fact, I've had a lot of people tell me that after the thyroid was taken out, they got more involved with their health, got deeper into things, and the result of all of it was that they felt better than they did before. Not because their thyroid was gone, but because the difference from losing their thyroid was a smaller loss than the gain of getting deeply involved with their health. So that's what's possible, and that's what I believe can happen for you. And if yours was taken out and you're not at your best, you're in the right place. Let's talk about the things you can do to make a big difference. So first off, let's recognize the role of medication. You need them forever. There it is, that sucks, I get it, so be it. I've actually seen some cases once a blue moon to where everything was thought to have been taken out and it actually wasn't. There's a thing called a pyramidal thyroid lobe. You've got these two lobes like a bow tie. Sometimes there's a third one in the middle that gets lost. I've seen that, super rare. But by and large, yeah, you need treatment long term. You know, it's treatment that has been around for over 100 years. It's always going to be around. You'll be able to get it. That's going to be okay. That won't be the real tricky thing. But you got to make sure that it's working right for you. And we'll talk a lot about that. For starters, you need to stay at healthy levels. And to stay at healthy levels, you've got to be regularly monitored. You've also got to test accurately. This is a big pitfall. This is stuff that you generally don't hear about. But there's 5 important rules to get accurate thyroid tests. You got to check your thyroid in the morning, ideally between 7 to 9 a.m. You've got to check it before you've eaten. So yeah, fasting. You've got to check it after 3 days of no vitamins. Yeah, even ones that are totally good and healthy, they're not going to hurt your body per se, but they're going to make the thyroid work differently in the test tube, and they can't measure it as accurately. Fourth one, you've got to test it at the right time of your menstrual cycle, if you're having menstrual cycles, and if they're regular. The right time is going to be your first 10 days, day 1 being the first day of your flow, or your last 8 days. So basically not mid-cycle. Simplest thing is test when you're on your period. That's the easiest way to know. Uh, and then the fifth one, this can be one of the biggest ones. You've got to test your blood before you take your pill. Get your blood drawn, then take your pill. So this may break the routine the day of the blood test. That's okay. But that one day you want to test beforehand. So you've got to test regular, you got to test accurately. Now, when you first start on medication, you'll need to test more often initially. I actually love to have people test within their first couple weeks of being on it, about a month after that, 2 months after that. And if they're stable, we'll look at 3, 6 months, and often I'll keep a schedule of twice per year for ongoing. But you got to check more at first because you may have some fluctuations. That's when they're most likely to show up. Now, here's a silver lining in the cloud that you probably didn't know was there. When you lack a thyroid, in most cases, it's easier to get your levels stable than when you have a thyroid. How could that be? Well, yeah, it sounds weird, but basically, when you have a thyroid, it is generally not making enough hormone, but it's often making some. It's rarely making none. And the amount that it makes can change. And medications fluctuate because they're working on top of an amount that's not consistent. You're basically working with what your body makes, and that's changing. So without a thyroid, you need a higher dose. That's not a big deal. But how much you make is 0. So that dose is adding up to a constant variable. So when it works well, you need a lot less changes and fluctuations than others do. Now, diet still matters. So we got to get the medications right. You got to have your levels right. And there's many medications out there. A lot of people do fine on the common ones. So that's going to be versions of T4 like Synthroid or Levoxyl. I know everyone in natural medicine thinks that they're the devil. They're not the devil. They're actually bioidentical. They're the same thing your thyroid makes. They're natural in that sense. They're chemically the same compound. And your body does make a lot of stuff out of T4. Most people can do that. Most can regain the capacity for that. Now, having said those things, I've got nothing against natural desiccated thyroid. You know, some folks do really well with it also. But there's really not one type that's everyone has to be on, and most people do okay on T4 when everything else goes right. So now we'll talk a little more about everything else. uh, Diet is still big. Diet's still huge. And here's the thing, you'll hear about diets saying that they'll heal your thyroid or whatnot. And you're thinking, well, that's a bunch of BS. I don't have a thyroid. Well, you're right. It's not to heal your thyroid. It's to help your body use thyroid hormones better. The biggest thing here is going to be iodine. Thyroid meds all contain a lot. Everything in the diet has some. If those two things total up to be above a certain threshold, your body blocks the thyroid hormones from the medication. And here's the deal, people prone to thyroid disease have genes that make them more sensitive to iodine and more apt to have problems when there's too much iodine. So even without a thyroid, iodine regulation is super important. It goes a long ways towards helping your body use the hormone better. Here's why. So we'll talk more about these, but your body uses the hormone via a group of enzymes called deiodinase enzymes, and they remove and rearrange iodine. They make the main thing your thyroid releases is T4. The enzymes make that into T3, into T2, into reverse T3, and actually about a dozen and a half more things too. And they're all important in their own right in various ways. So you need your deiodinase enzymes to work. Guess what? If deiodinase enzymes are plugged up with iodine, they can't work. So it's not that iodine's bad, it's that it's everywhere. We've got a lot of it. We get enough. And when you're on thyroid meds, you're already getting it there too. So we're not trying to avoid it, we're just trying to keep it into a healthy range. And with the meds and with pretty much any food in your diet, between those two, you're fine. The bigger risk is too much. And that's a big thing towards making the meds not work. That can actually change blood levels quite commonly, or even short of that, it can still cause a lot of symptoms because it changes how these hormones get absorbed by your body and used by your cells. Now, the other big thing that matters is nutraceuticals. There's a lot of micronutrients that help with just that, with those deiodinase enzymes. They help your body use hormones better. And some are just because they're parts of how your body makes those enzymes. Things like selenium and zinc and iron, vitamin D, they're critical parts of your body's chemical pathways. And when they're not at the right levels, you can't juggle and rearrange thyroid hormones the way that you really should. The other part about nutraceuticals is that there's compounds independent of how they work with normal function that have been shown to help your body do a better job with using hormones, managing symptoms, converting hormones, and feeling better. There's been many shown just simply to benefit overall states of hypothyroidism. And these things are useful, they're important. You want to take them at a separate time from thyroid medications, at least an hour afterward, but they can make a huge difference on keeping your levels stable, helping you get more out of your medication, and helping to prevent other complications. Other big step is keeping up with your screening. Now, part of that was the regular blood test that I mentioned, but in almost all cases, you still want to do ultrasounds also. You're thinking, on what? There's nothing there. Well, good, we want to be sure there's nothing there. There may not be nothing there, or there may have been a speck there that might grow back. So that can happen. Stay on a schedule with your ultrasounds. Ask your doctor about that. In the same vein, do a self-exam each month. Uh, Check me out on social media at dralanchristianson.com. I do these live every month with everyone. Facebook, Instagram. Yeah, I'll jump on the beginning of the month. I'll walk you through it, and I'll be back again next month, and I'll keep nagging you to do them. But do your self-exam. This is how nearly all the weird stuff gets caught, is that people figure it out on their own, and then they get it checked out. Another big thing is managing the conditions that go with thyroid disease. The short term is comorbidities. Now, there are a lot of them, and they're super common. There's some things that are mild and very common, like latent iron depletion, being a little low in iron. And there's others like parathyroid disease, which are not as common, but there's still things that show up 5 to 7% of the time for anyone with thyroid disease, and much higher for someone who's had thyroid surgeries. But there's about a dozen and a half conditions that you really want to have on your radar and your doctor to be aware of. So you want to stay in contact with a doctor who's a good diagnostician and can help navigate these sorts of things. I mentioned a couple, there's a lot of other big ones: celiac disease, adrenal insufficiency, sleep apnea, fatty liver. Those are some of the top few. But what can happen is that people can think anytime they don't feel well, it's because something is wrong with their thyroid medication. And of course, that's possible. But having had thyroid disease, you've got a really big risk for having other things as well. And a lot of these things are not picked up on. And I see it happen a lot to where doctors fixate on, let's keep tweaking your meds to try to fix things. And that wasn't the problem to begin with. So you really want to work with someone that can help diagnose and understand these deeper conditions. Next up is going to be exercise. This is medication. This is in its own right. There's so much data about how exercise affects people that have had thyroid surgery and have hypothyroidism and are on medication. The punchline is it's a dang big deal. And cardio weights, a study came out just a few days ago, actually, looking at which was the best, how much helped, how much did it help, and the best is both. You get the most benefits by doing both. And it's not massive amounts. About a half an hour, 3 times a week. And if you're covering cardio and weights, that little can make a massive difference in terms of your objective thyroid scores, your quality of life symptoms, your overall energy levels. It's huge. And of course, it's great for anyone, but specifically with someone needing thyroid treatment, it's massive. So those are the biggest single action steps. Let's talk through about now why you may have gotten here. So why would you need long-term thyroid treatment? Why was your thyroid taken out, or why was it destroyed? Yeah, the most common scenario is surgery, and especially surgery secondary to suspicious nodules or overt cancers. That's the most common thing. Next up, we think about radioimmunoablation. So someone's had iodine ablation, and that was done because their thyroid was generally overactive, enlarged, out of control in some way. In those cases, there may be just some traces of tissue left, but not enough to do really much of anything, and generally treatment is needed long term. Next, we think about a rare variant of Hashimoto's called Ord's disease. Many think that Hashimoto's is just like a stepping stone to the thyroid shutting off. No, it's really not. That's not typical. But a rare variant called Ord's disease, it does shrivel down to pretty much nothing. And that can lead people to where they do need medications long term as well. And then also we think about congenital hypothyroidism. This is also quite rare. Oddly enough, the only cases that show up in the recent past have been from people from pregnant women taking massive doses of iodine during pregnancy, and that shuts down the baby's thyroid development. So this is iodine again. It's something that we need, but there's a lot of dangers of too much. But yeah, this is rare, but of course when this happens, someone's born without really a functional thyroid at all. And then last up, how does this affect life expectancy in general? Well, the lack of a thyroid does not. It doesn't really change your life expectancy or risk for big health conditions, thankfully. The medications, if your amounts are wrong, it's a different story. And then lastly, if you had surgery due to disseminated thyroid cancer, then that can affect longevity, especially if that happens after you were age 45. Before then, not as much, but afterwards, it may. So synopsis, you can thrive, you can feel fine, you can feel great again. And if you don't, know that there are finite, objective, knowable, treatable reasons why. And don't ever give up on finding and resolving those things because it can happen. So without a thyroid, you can still do great. All right, Dr. Christianson here with you. Take great care, and I'll see you real soon.